So there are 3 different types of ultrasounds that you may encounter. There's a first trimester ultrasound, there's an anatomy ultrasound around 20 to 22 weeks, and then there's a follow-up growth ultrasound, which is closer to like 36 weeks in the late 3rd trimester. In the first trimester ultrasound, we're going to be looking at how big the baby is. We're going to look at all the structures on the baby. So the brain structures, arms, legs, stomach, kidney, bladder. And then we're going to look at the back of the neck and measure the back of the neck, which is the nuchal translucency, and make sure that there's a nasal bone. And so when we look at those things, we're making sure that we have a nasal bone and that the back of the neck is not larger than 2.8 millimeters. So those are markers for Down syndrome. But the doctor would talk to you about those different markers and the risks that are associated with those markers if there's anything that's abnormal that we find. And then in the anatomy ultrasound, we're going to be looking at everything in detail, all the brain structures, face, hands, feet, legs, the heart especially, all the organs of the body. And then we are looking at the placenta, making sure that it's not close to the cervix because we don't want it to be within 2.5 centimeters of the inside of the cervix. And all of those things will be discussed in detail with you. And then we're looking at all of your anatomy as well. So we're looking at your ovaries, we're looking at the uterus, we're looking at every part of this pregnancy, including you and the baby. And then whenever you get into the 3rd trimester, we want to make sure that nothing has changed between the time that we've seen you in the 20-week anatomy scan and your 3rd trimester. And so we're going to measure the baby. We're going to take a look at all the fluid around the baby and measure that. And then we're going to take a look at stomach, kidney, bladder, and take a look at some of the heart views and some of the brain structures again, and make sure that everything is going as planned in your pregnancy.